Hi everybody, it's Dr. Eric Balcavage. I'm back for another edition of Thyroid Thursdays, and I'm going to continue the discussion on the 6 primary hypothyroid patterns, and we're going to talk today about thyroid overconversion and decreased thyroid binding globulin. So when we take a look at this pattern, what we're going to see is that the patient has adequate levels of T4. The problem occurs is that they're taking that T4 and overconverting it to T3. And they're either overconverting it or they just don't have enough thyroid binding globulins to carry the T3 around the system, and they wind up having too much free T3 available. And at the outset, that may sound pretty good for somebody who's got hypothyroidism. You would think, since free T3 is what actually gets into the cells, into the nucleus, binds and turns on the metabolism, that having plenty of T3 would be a great idea. Unfortunately, if you flood the system with too much free T3, the cells can actually become resistant to it. So you can have plenty of T4, plenty of free T3, and yet the cellular system will resist it. So just like too much insulin can create a problem, too much thyroid hormone, especially in a blast, can create a problem, and the cells can become resistant to it. So when we look at this pattern, thyroid overconversion and decreased thyroid binding globulin, really the big cause of this is insulin resistance, and especially in women, as they become insulin resistant, they have elevations of something called testosterone, and testosterone will decrease the thyroid binding globulins. So with fewer thyroid binding globulins, I have less that carry the thyroid hormone around the system, and so I'm going to have more free hormone available. I may also be getting overconversion of the T4 to T3, and that can accentuate it, make it worse. So what are we going to see on labs? We're going to see a normal TSH, T4 may be normal, maybe low if there's an overconversion issue, but probably in the normal range. Free T4, it could be high because there is not enough thyroid binding globulin to float around, so free T4 levels may be elevated because T4 is on the thyroid binding globulin, free T4 is not on the thyroid binding globulin. So T3 uptake is probably going to be normal or low. And why would we say that? Well, T3 uptake gives us an indicator of how much availability there is to bind more thyroid hormone. If I've got low levels of thyroid binding globulin and I'm probably maxed out the capacity of the limited amount of thyroid binding globulin to bind anymore, so our T3 uptake levels are going to probably be normal to low. If I look at T3, those values are going to probably be normal to low. And if I look at free T3, those values are probably going to be high or high norm. Just like the free T4. Reverse T3, I think at the onset of this, it's probably going to be normal. But as this progresses, you're probably going to start to see higher levels of reverse T3. And in this situation, we don't have an antibody response. This is not an autoimmune condition. And so our thyroid antibodies are going to be negative. So this is another reason why it's really important to run a full thyroid panel. If your doctor only ran a TSH or a T4, you would miss this whole overconversion, low thyroid binding globulin issue. And so this pattern would be totally missed. You'd have hypothyroid symptoms. Your doctor would probably think you're crazy, nuts, or lazy, and you'd probably wind up on some type of anti-stress, anti-anxiety medication. So this is another good reason for a full thyroid or comprehensive thyroid panel. So that's the 4th hypothyroid pattern that we see as the most common hypothyroid patterns. And next week, we'll talk about the 5th of the most common hypothyroid patterns in our next Thyroid Thursday moment. All right? If you have any questions, add them in below the video, and I'll get back to you. I look forward to talking to you next Thursday. Take care.